Good evening once more. I would love to welcome all of you to our Womb Care Clinic webinar. Thank you to everybody that has logged on. Today, as Womb Care Clinic, we decided to have our one of Let's Talk About webinar, and we've been absolutely honored to have Mr. Anthony Chipulu, who's a mental health specialist. He's one of our consultants as well at Womb Care Clinic, to simply come and talk about a very important topic, which is simply dealing with bad news. I think it's something that we can all relate to in our lives where we have received bad news at one point in time. And I think how you get to handle that situation is something that is very important. I'll be your moderator for this particular webinar. My name is Paul Mwemba. I'm a consultant obstetrician and gynecologist based here at Womb Care Clinic. Before we dive into Mr. Chipulu's presentation, allow me to just introduce who Mr. Anthony Chipulu is, a man with experience, empathy, and excellence. Mr. Anthony Chipulu is a distinguished mental health practitioner with over 17 years of clinical experience in psychiatry and mental health service delivery. He holds a diploma in clinical psychiatry and a bachelor degree in mental health and clinical medicine, and currently serves as the head of the mental health unit at Solwezi General Hospital. Mr. Chipulu, in addition to his clinical and administrative roles, is the mental health focal point person for Northwestern Province, where he provides technical leadership in the planning and implementation of mental health programs. He is also engaged as a part-time consultant mental health specialist at Womb Care Clinic, contributing to the integration of mental health services into primary care settings. His areas of expertise include community psychiatry, psychosocial intervention, mental health advocacy, and health system strengthening for mental health services in Zambia. Mr. Anthony Chipulu, on behalf of Womb Care Clinic, we are very, very grateful for having given us this opportunity to share your presentation. Welcome and good evening.
Good evening, Dr. Mustafa. I hope I'm audible enough to everyone.
Yes, you're very much audible. Please do share your screen and your slides, and then you can go ahead with your presentation. Thank you very much for honoring us with your presence.
So thank you so much for joining in, especially for those of you who are on board today. And thank you for joining Home Care Clinic as we are preparing to share our PowerPoint. So this evening we just decided to talk about dealing with bad news. It's not a professional based talk. It's specifically for everyone of us. It's a community talk. We're not going to address the clinicians here. We'll not be addressing people as clinicians. We are discussing as just as a community. So it will be a community discussion. So I hope okay. So yeah, and thank you so much for that wonderful introduction. So once more, let me welcome everyone as we begin this discussion. So basically, why are we here this evening? Like I've already talked about peace. We are living in a world which is very unpredictable now. It's very difficult for someone to really be careful with what is happening around you. It's very difficult to really protect you from these bad news that you receive. It can be either a condition or just any other type of bad news. And this bad news affects our emotions and our thinking. And when these two things are affected, we fail to function in our daily activities. And it is at this point when you fail to function that many people even start seeing that you're not doing what you're supposed to do as a husband or as a professional who you are at work. So this session will just help us to cope with healthy in a health way. Okay, practically we are going to look at some things that will help us cope whilst we are in those bad situations. So if you're struggling, it's not a sign of being weak right now. You are a human being, and we need to appreciate that we are human beings. And now God has made us, we are kind of very complex. We have the biology that we even fail to understand, and this bad news affects our biology. So basically, the thing that we'll discuss here will just help us cope and be able to continue living positively. So what is bad news then? So it is any information that changes life suddenly or painfully. It threatens our health, our relationships, work, or future plans. The examples I can give is that some diagnoses that are very bad. Anyway, when I talk about diagnoses that are very bad, of course, we have conditions like malaria, and there are severe conditions like cancer, mental conditions. So these conditions sometimes they can heal others. We have to live with them until we die. So when it comes to you, it comes a very bad news. It takes you in a corner where you become so lost. The other example is the loss of a loved one, loss of a job, infertility issues, and disability of any form. So basically, those are examples. There are many. Just pick those. So I just want to quote Bob Bachman. So this man worked as a chairman, okay, in one of the laboratory setup. And you know what? Most of the time we get results from the laboratory. So we looked at how people were being handled, okay, especially when they are receiving bad news. So this is the quote that we usually use, and this just reflects to us who give bad news that we are the first line support system. So the people who are giving you that bad news are the first people who you should be with. If you have questions, you need to really listen to the people who are giving you the bad news. It's an encouragement I'm giving you. So for him, he said, because he was the one who was dealing with lab results, he said, if we do it badly, the client or family members may never forgive us. But if we do it well, they may never forget us. So meaning that he had the patient, you know, at his, he focused on the patient, the recipient of the result. And it should apply to us even the same. So don't think that when the doctor or maybe it's at work that you're being given information, they don't care about you. Support system starts from where you're getting the bad news. It's very, very important. I want us to just react, have some reactions from you. I know there are people who have received bad news. Just post in our chat box. The question is that when you receive bad news, what is usually your first reaction? So this is very subjective. The reactions will be different. We'll look at that later. Kindly post in the chat how you really feel, or what will be your first reaction when you're told that, let's say it's a diagnosis which is very bad, or any other information that you take, or that will be very bad to you. So as we continue, these are the common reactions, and I know in the chat box some of these are there. People go into shock and disbelief. They develop fear and anxiety. They develop anger or blaming. It's either blaming oneself or another person. And this becomes a problem, especially when you start blaming yourself. And these are the time that you see people, those who commit suicide, when they blame themselves so much, they'll end up making very bad decisions. But these are the reactions. So we need to understand what's happening around our friends. Sadness and grief comes at the center of everything. There's confusion, there's numbness, you just feel like you can't function. All these reactions are very normal. It's normal to feel this way. But what is important is how long are you going to have to be in these reactions? Because you are a human being with this biology which is complex. The science we have from our end is that the biology that we have sometimes, when you're in this situation, there are some chemicals that are produced in high levels. There's the rush of adrenaline for those of you who understand biology. There's a rush of cortisol, chemicals which brings a lot of negative feedback to your body. It's normal to feel this way, but it's important that first you come out of this so that there's no negative feedback, there's no long stay in this, and you develop depression. So feeling this way is very, very normal. We will review what you posted in the chat box later on. Dr. So I don't know if I can be guided if you want us to look at that already, or we can continue.
I think we can continue, and then we'll be able to look at them later on, some of the reactions that have been posted, and just to see how best we can tackle some of them that would require immediate addressing.
Thank you so much, Dr. So why bad news feels overwhelming? Like I mentioned, it strengthens our sense of safety and control. It brings uncertainty about the future. It may trigger past and painful events. We have heard of conditions like PTSD. Some situations have happened several times to some people. There's some people who have been involved in accidents. Okay, and again when they continue, being involved again in the same situations, this now becomes a trigger to their past experience. It can be maybe at some point you lost a job again. So it can trigger those past emotions and worsen the outcome. So all those things we talked about, it can be something that can come back again. So really bad news affect us in these ways. It can make you feel alone again. And in that moment, you need support system. You're going to look at that later on in the presentation. Now, in that moment, when you received bad news, these are things that you can agree with me that happen. We have personal values as human beings. Having a family is one of the values, right? Belonging to a certain grouping, let's say a church, it's one of the values. There are some people who want to achieve something in life. Those are the values. So these values, they are threatened, okay, when you're in that stressful period. Okay, so we get to be hooked and we are pulled away from our values, which are very important. These values, they make us be who we are. They make us a person that we want to be tomorrow, and I want to treat other people and the whole world around us. So these are the deepest desires for a sort of person you want to be. You agree with me that most of the time when we have this bad news coming to you, all these values are threatened. But it's important to realize that you are a person who's supposed to be in this world where you need to be treated well. Okay? Sometimes we blame people who give us bad news because they belong to the same world. But in that moment, it's okay to feel this way. But We want you to stay in that and hold on to these values because these values are very important for you to function tomorrow. So this slide just talks about how people may react to some bad news because these bad news become so stressing. It's not obvious that you're going to avoid these feelings. Okay, some people will lose focus; they cannot focus completely. Not that they are failing to focus because it's just the problem with their brain in that moment. It's because of the bad news that I've received. Imagine you are a person who has been so productive at work and then you're told something different. So you need to acknowledge, okay, why am I not focusing? What is important is for you to focus on dealing with that stress that came in that moment. Others will get angry easily, others cannot sit still, difficulty in sleeping, there is a tendency of worry, others will cry, all these things. There's changes in appetite. Others will eat quite a lot when they have bad news. Okay, others will not even eat. So it's not everything that will happen in you. It is very, very subjective. Many of us think a lot about bad things from the past or bad things we fear in the future as well. And this, we call them irrational thoughts. Because if you're scared of the future, you're not so sure about what's happening. There's no evidence that these things is going to happen. So you are thinking in a negative way. So what is important for you is to worry. You need to be living in the moment, in the now and then. That's how you're supposed to be focusing on your future. So, but okay, now there's now what happens to your body, the reactions I talked about the biology as human beings. When those chemicals now are highly produced, the adrenaline, the cortisol, this is what happens. Some people complain of the headache on the other side, okay? Not feeling hungry. Others they'll say, they'll go to me, the lump on the throat, especially those who feel like, who are in like, who go into depressive states they have been given bad news. So if you talk to someone, they'll tell you, something has been just in my throat, like it's a lamb that has sat there for a long time. Because you're taught to deal with the bad news. Okay? The heavy chest, tight muscles, upsetting stomach, the backaches. Other people find it their body gets sick. Even skin rashes, the immunity gets to be to be affected as well. Infection may come in if you have been given another condition, even another condition can develop when you fail to handle this bad news properly. So as part of sharing this slide, so that we understand, maybe some of us are already facing these things because they've been given bad news. It's important that you recognize these things so that you pass fast, you take up that responsibility and seek help so that we can deal with this problem before you develop a complication due to bad news. So the other four, I want people to just we continue interacting in the chat box. How do you think people mostly cope with bad news in our community? In your own understanding, it's very subjective, but how we just feel people cope with bad news in our context, let's say in Zambia. So we need to have this discussion so that we see how people cope. I have my own way of how we have seen things, but I want to listen from you and we are going to discuss these things. There are no right or wrong answers here. So just post whatever you post. If you are the ones who have been copying that type move in that way, kindly post exactly that. So as we continue, these are some of the common things. Some people, okay, talk to someone when they are bad news. They decide to figure out, let me talk to someone so they can vent and maybe they can have an opinion, maybe someone can suggest to them, okay, on what they can do. Others you just keep quiet and be alone. Others resort to drinking alcohol or use other substances. Because of those things we talked about. When you are having the headache, you're not sleeping, people have a tendency of using alcohol as treatment. So it's not just alcohol, there are other drugs that are over the counter. You just go in the pharmacy, I want some medication so that I can just sleep. Not knowing that the major problem is the bad news that you have received, you need to talk to someone, or you need to positively, you need to be supported. We end up resorting into using drugs to treat our own problem. These are things that I know happen. Some people go for prayers or spiritual support, and it really works. Okay? So our job here is just to understand what happens, and then we can choose what is now right and what is bad. So from our end, this is what we understand, and the unhealthy way of coping. Suffering in silence is a very bad way of coping with a bad news. You are not alone in this world. A human being is a social being. We know you have been disappointed by some people. We have been disappointed by your friends at work. But still, sometimes we develop these negative thoughts we call cognitive in errors in the way that we think. That okay, because this one said this when I share, obviously when I talk about this issue, they will also take it in the public domain. That's a problem. You end up suffering alone until you just drown. So it's important, okay, to find people that you can share with. It's not just you have to go and share to the whole world, but you need to be very critical in the way you choose someone that you share with. Of course, there are bad people and good people in our communities. Substance abuse, I talked about very bad way of coping with bad news. Okay, withdraw from family and work, a very bad way of coping because you need to function after all. It can be bad news that is not related from work, then from nowhere you just decide to stay away from work. Your family needs that you continue providing for them. And that is why we are here. How are we going to be dealing with this thing? Because we are living in a world which will continue throwing stones at us, and we need to know that we need to be helped. Hunger, violence, or hopelessness, these things are very bad because hunger will bring in fight. Or the same hunger without violence can continue bring causing more negative bad chemicals from your body to be released and disturb your brain biology, and you continue suffering mental instability. So these things they increase emotional pain. So this bad way of coping. So better ways of coping. It's important to understand, okay, that okay, it's okay. You're going to be fighting, but accept your feelings in that moment. Don't fight the feelings because in that moment you're the one feeling the pain. So we say it's okay sometimes not to be okay. But what is important is how you traverse those situations, how you move out of those situations. Very, very key. You need to talk to someone first. Take one day at a time. Some people rush, they are feeling of making decisions in a rush. That's why we have seen a lot of suicides happening. People are trying to commit suicide. Others are even ended up dying because of not thinking properly, not thinking about tomorrow. Maintaining routines where it's possible. We are going to look this into details on the things that you can use based on this slide. Managing shock and fear. We are going to look at how we can manage this, but briefly I'll talk about this. There's a way of how we can manage when you're in shock, when you've been given the bad news, it takes you to shock and you develop fear. There's a way of how you can pause and breathe properly so that you protect your biology. Okay? How you're going to ground yourself and ask questions when it's ready. Remind yourself, I'm still here and I can cope. You have all the support system that you need. The problem is that we don't know where to find it, and sometimes we stigmatize ourselves. We feel there's no help out there. So coping with grief, it's usually grief has no timetable. You can't say, "No, I'm going to do this at this time." You just have to be so strategic. Crying is not weakness. Okay, it's okay to cry sometimes. We have this problem of monocyte in Zambia. Men don't cry. And crying, for me, I take it like it's some kind of I don't know if I can call it a proverb or what, because sometimes by talking to someone, it means crying. It's not just crying like you're tearing and you are screaming loudly. For men, when you share a story to your friend, that's also part of crying. You understand? You open up to someone. Sometimes you can cry a little bit. That's why you see us men in Zambia, when even there's a funeral, we don't cry. Just there and then. If there are few men who cry, it's because they've been you don't cry, your man have to be strong. But inside it, your biology is dying. You're killing yourself. And these are people that you see they will be having bad ways of coping with their stressors. Eventually they change their personality. You are a good person initially from nowhere because of this bad news, you even change because of this culture that we have. But you have to remember that healing does not mean forgetting. The things remains in our brain. Our brain keeps all the bad memories that disturb us. So when you heal, you are going to remain with the memory. But at least what is important is for you that at least you know you healed and you are functional. What is important is for you to function in many aspects of your life. We have psychological techniques that I'm going to talk about now, that you can apply on your own without even going to see a psychologist in situations where you have been dealing with bad news. And some of these techniques we also use in our setting profession. And I think countrywide now we're even teaching people, even those people who are not even trained in mental health, they are able to do these things. So these are brief psychological interventions which offer versatile tools to manage stress, improve emotional well-being, and enhance coping skills in various contexts. In our context, we're talking about dealing with bad news. The first one, I know you've heard of diaphragmatic breathing, right? You've been told to, okay, if you're crying, let's say you've received bad news, you tell, okay, can you just relax, take a deep breath. There's a science behind this. It's not just breathing and then it ends there. So when you do that, there are three areas in your body that you usually you need to focus on because you want to protect your biology, your body, and to function. The brain is important in that moment. Your heart, your lungs are important. Your stomach is very important for you to keep your biology functioning. And these things we lose them. We don't think about them when we stress period. We even fail to breathe. And people go into panic state, they even faint, others they even develop stroke. So this technique is very helpful, even at work or in future when you come across bad news or any shocking events, you can practice this very simple technique. Within 10 minutes, you should be able to feel calm. All right. So as you are doing this, it's not just breathing. This is a technique. So step one, assume a natural, okay, comfortable position, either sitting up straight with your head, neck, and shoulders relaxed, or lying your back with your knees bent and your head supported. In this moment, you need to close your eyes and loosen your binding clothes. Might be putting on a tie, can be a bra, agreement. Importantly, in that moment, we want just the body to breathe to have enough oxygen. Okay? So in order to feel your abdomen, because as you're breathing, we want the diaphragmatic breathing. We want the air to go in your diaphragm. In order to feel your abdomen moving as you breathe, place one hand on your upper chest, like it's saying there, and the other below your lower rib cage. You want to be feeling the air heavily. Because what we want from that air is oxygen. In the moment where you're in a panic state, you will not benefit from the oxygen that is important for your body to function very well. So you need that oxygen so that you can calm down, so that those chemicals that are releasing the cortisol should not rush into your body. You need to breathe in slowly and deeply through your nose. Feel your stomach expanding into your hand. The hand on your chest should move as little as possible. In that moment, you are focusing on your body. We know that in that moment you are in a stressful period. So, what is important for us is it's normal for your brain to wonder about what you've been told. Because I know some of you are asking, okay, how am I going to do that when I'm told you're fired or I'm being told you're cancer? You understand? But this technique will help you protect you. You need to think of what next because you need to function. In that moment, you might feel alone, but there is a family that depends on you. There's someone who depends on you. So this technique will protect you from doing some things that can be so related to your health. And then you exhale slowly through your mouth, feel the fall of your head of your stomach away from your hands, and again you continue the same. You need to concentrate on the act of breathing and shut out external noises. Because in that moment, actually you need a quiet place. You can excuse yourself if you're at work and you're giving somebody else. Okay, give me 10 minutes. Within 10 minutes, if you are supposed to make a rash decision, that is not going to happen if you did this technique. So this is a psychosocial intervention. You don't have to be a professional to learn this. It really helps. You can look it up also on how it's done on YouTube. People have posted here and there. But we do this most of the time when we deal with people who are in specific situations. Then the second one is grounding technique. I talked about us being hooked away from our values in the area in my opening. Okay, so how this technique works is that we utilize the sensory awareness and visualizing to reconnect the present moment, detach from the distressing thoughts, and regain emotional stability. When you look at these hooks which are down here, you know there's some hooks, some things somebody use that can easily go away. When you look at this slide here, there are about three types of hooks. I can see one hook where there's a fish. I don't think this hook is easy for someone to just survive when you're hooked on this hook. It's difficult. And this is how some solutions might need that some situation might need that you need some kind of support system. The other hook as well, you can just hang it. You can deal with it on your own. All right. So this is just some kind of pictorial way of showing you how even these barriers can be. Some things that can be easy, and some people have better ways of coping. But other people will still struggle. So we're not saying it's always that you have to go and seek a profession, but there's some situations that are so difficult that you have no control of. Okay, so it's when you ground yourself, you're using your senses. You can agree with me. Some of you have been told you have this condition. I don't think for those of you who love coffee, if you can even smell that coffee properly, that this is the aroma of the coffee that I'm taking. When you're in that stress moment, if it's a food that you like, it's a fish that you like eating, I don't think you're able to taste that food properly. So in that moment when you ground yourself, okay, I think I've too many thoughts to think of, I've too much to think about. Ground yourself. Some people suggest that you can even walk barefooted in your house. You feel your senses. Okay, you can use your senses to calm down yourself. In that moment, you're drawing your mind away from those disturbing thoughts or disturbing bad news. So you ground yourself. You are in the moment. You are in the now. In that moment, sometimes you can even stay quiet and start getting which sound is so close to me or which is so distant. That is how grounding happens. So as you're grounding yourself, you are unhooking yourself from this bad thought. That is another technique. Very easy to do on as well. The other one is mind exercise. I think this one is very common now. We've heard of the yoga, all right? Okay, so here you practice non-judgmental awareness, thoughts, feeling, and bodily sensation, fostering a sense of calmness, courage, and acceptance. So it's just minding the body. Sometimes you call body scanning. Okay, I'm in a stressful period right now. I'm so stressed. Remember we talked about those feelings, the headache, the lump on the throat. Sometimes you can't even notice it. You can be moving with it for the past month, but when you talk to someone who is a specialist, will ask you, do you ever feel like this? You say, actually, I've been feeling it for a long time, but I was thinking it's another condition. Okay? So it's important that you know how your body feels when you're in a good situation. Carry your body, feel how your heart is pumping, how your chest is. Okay? So that's what you call mind exercise. You can do that by practicing yoga, you just quiet, feel your body, and these things that you can see on the picture here. So it's another way of identifying. So I think the stress or the bad news is affecting my biology and my body, my physical well-being is not stable in this moment. The other one is kind of a technique that we use. There are people who don't, like for instance, after having the bad news, maybe you stay with it, maybe you are in denial for a long time. Okay, it's called deep muscle relaxation. Some people have stayed for more than 1 week without sleeping. 1 week straight, no proper sleep, maybe just 1 hour. You've slept a lot. So this technique helps you to loosen up the body. From my practice, I've encountered people sleeping when I'm offering this technique. They will just go into deep sleep after completing the whole stage. So I'll not go through it for the sake of time. You can look over it. Uh, Actually, you need someone to help you because you in that moment you need to focus on what is happening. But these are the things that you can do. Okay, so here some kind of systematic tensing and relaxation of muscle groups to reduce the physical tension, alleviate body discomfort, and promote overall relaxation and well-being. Okay, so there's a lot of physical tension that comes in when you're stressed because of bad news, whatever bad news it can be. So you can help your body feel calmer and even be able to sleep without even going to look for a prescription by using this technique. Okay, so you start with your feet and move up. So those are the look it up. If you want more help about this one, we can chat on the other side. It's a kind of long, but I thought of just putting it here. But we can also chat on the other side. We can work on it. Or I don't know because we're going to advise if we do it representation. Usually, it helps quite a lot when you're stressed. When you look at this picture clearly, you can see people doing different things. Okay, some things are not kind of in our context here, but we have our own way of doing of being what is happening here. We can contextualize art and creativity exercises. Okay, drawing like something like drawing like okay, you can communicate like for example in children we have difficulties to talk to children who are especially adolescents. Some children they fail to say how they're feeling emotional. So we just tell them, can you draw how you're feeling or draw your family? They will just draw something that maybe you see someone drawing the father holding the knife, trying to stab the mother. You understand something like that. So it's just an example that I thought of bringing that even this one it helps. Okay, so you are engaging in expressive art such as drawing. You can draw some communicate emotion, painting. Okay, the emotion. Let's say if you're a person who like bright so always on black so you just look at the pattern okay what now these days I'm just putting on black what's happening you find that you're trying to express your emotion through uh
the way you're doing your things. It's like some kind of art that is kind of your subconscious. All right. You can listen to music. You can do the same yoga like you have said. These things they also help. All right. So this is another thing that this is another aspect, another successful intervention that you can adopt. So it's not obvious that you can do everything, but you need to find one successful intervention that can work for you. That from what we've discussed here. So now, all these things we have talked about in terms of coping positively with the stressors, it just help us to function at work. And what is very important. We need to function to contribute to our family well-being, to this nation's well-being. You understand? No, suicide is not a solution. Or giving up in life is not a solution. What is important, you can struggle, but you need to function. Remember when I talked about having these memories, you can still fight your problems and still function. Your memory will still remain with you. Okay? So communicate when you are in need of the support. You need to break tasks into small steps, rest and eat regularly. It's very, very important because when you develop the habit of eating well, we forget about ourselves in this moment. When we are so stressed, we forget about ourselves. We fail to rest, we can sleep, we can eat properly. You need to be patient with yourself as well. Alright? We can have another chat. We can post something in the chat box again. If values become so overwhelming, who would you reach out to? First, it's again subjective. So the reason why I'm asking this question, we want to know what's happening in our community. Where do you go to when you're so stressed? Okay? With this, the answers that you're going to bring, we will respect them. We're not going to be judgmental. What is important is we want to see who is supporting you. You want to build a support system in our community. We want to avoid people staying alone and dying in silence, as you've mentioned. Okay? Because this helps us to understand support gaps. Very, very important. So the power of support, okay, family and friends. But because of some situations, some people have the tendency of staying away from family and friends. You know, we are different personalities. There are people who think they are strong, they can do it on their own. Support system is very, very powerful. You need someone to support you. It can be at work, it can be at home. It can just be friends from where you stay. Faith and spiritual leaders. These people, they really help us. Most of the time, they speak positively in our lives. We go there and people become so resilient, so strong because of the faith is always, being strengthened by the spiritual leader that we have, by faith leaders, the pastor that we have been changing. This is very important for your mental health. All right. Even us here on our ends, when someone says, "Okay, I want to go to church," we encourage them. When they go to church, but do not leave. If they say it's a severe condition, do not leave your tablet. We want to work with people in churches because we know the importance, the role the role that they play in maintaining somebody's mental well-being. Peer support groups very important. Mental health professions usually are the last ones, and I think you can agree with me. It's there are few people who really can turn fast to mental health unless maybe I don't know maybe from our culture. The first people that we get support from is the family, churches, and our friends. When you see people coming to us with severe, going out of the home, they're sleeping, maybe becoming violent, maybe drinking so much. We can change this narrative. If you feel support in family is not coming from the family, you can rush to, you can go and see a profession. But all these things are support systems that are workable. Okay, and we are happy because some people don't come to us. They are helped at the level of just faith and family. You don't even reach the mental health specialist. And this is what you want to continue doing. But when you see someone is struggling so much, you don't hesitate to look for, to ask for mental health professionals. Hearing our problems reduces emotional burden very, very much. Sometimes we share and expect that maybe we're going to be given something in return, or when we share that I don't have a job, someone is going to give me a job. Those motives are there. But what is important is when you talk to someone, I think some of you have talked to someone, you have seen that the burden, is kind of lessened when you talk to someone. You feel better that you're sharing your story with someone. That is what is very, very important on this life. So when you seek for professional help, when you there's persistent sadness or anxiety or even depression, maybe you are thinking of not continuing to live, you think your life is not worth anymore. It's important that you see a professional because in that moment it could be that maybe you are becoming so overwhelmed with your biology now because now those things have happened. Now you are going into stage where we need to replace maybe the chemicals using the medicine. But that should be the last thing that we recommend. We don't want to be prescribing tablet to someone over some things. By discussing these things and practicing what you've talked about, we should be able to prevent a severe condition like anxiety, which is severe, depression, which is severe. You can fight anxiety, you can fight depression, you can fight all these thoughts without, by just using what you've discussed, this information you've discussed. Sleep appetite problems lasting for weeks, you need to see a profession because sleeping is very, very, very important for your well-being. Appetite is very important. That body needs nutrients that are very important for you to function. It's not just eating actually any food. Eating food that adds value to your well-being as well. It's very, very important. The reflective question, as I'm about to conclude, I want us to ask ourselves, who do I usually turn to when life is hard? Do you have that person? What stops me from asking for help if you don't have that person? Because these things are very important. You need to uh, kind of think about these things very critically because we are looking at building support systems within our communities. Okay, and what support do I wish I had? Okay, I know some of you feel you don't even have support system. Do you wish you want something better, or maybe you want something that has never been offered? All right. So these questions are very important. Something that we just reflect on. Maybe this makes you not to seek for support from our friends. Yeah. So for people receiving difficult diagnosis, maybe you are here listening and you have just received the diagnosis, which is very bad. It's okay to ask for information. It's important. Let's not that bad news. Let's say if it's a diagnosis, deter you from asking further questions. Because some of us, once we are told, no, you have this condition, we become so overwhelmed, you feel now, okay, this is the end. We think, okay, now this is catastrophe. You need to ask more questions. The doctors have the information. Doctors or whoever is giving that information, they know their limits, why they can't support you or give you proper information, they refer you to the other person. That is part of management. So it's important that you ask more questions. Write down questions for your health worker as well. If you can't talk to them in that moment, you can just send it. It's okay. Don't feel because sometimes we feel we are burdening our health worker because of the attitude that we have seen in the public domain. No, this is what the doctors are what. Sometimes it's important just to become friendly to these people. Okay. Of course, there are people who have attitudes, others are very good. So as you even receive bad information, let's say you are told maybe you have symptoms, or maybe you have an idea. You need to have someone that you trust, okay, that you can come with for appointment. It's important because we are talking about a support system. If you can't handle that without that day, someone is going to help you carry through. If you're driving, someone will drive you. Some of these accidents we see in these roads because of lack of support system. You go alone to the hospital to get results, you are told you have a bad result, you can't focus on the road, accident happens. And it's difficult for us to do forensic investigations and give. Some of these are, they contribute to these things that we were talking about. Emotional reactions do not mean you are weak, like I talked about earlier. It's okay not to be okay. Crying is okay, but we don't want to overcry, to cry for a long time. We want you to have support system so that someone can help you move out of that moment. Treatment works better when mental health is supported. Let's say you're in treatment, you've been given a diagnosis. Your mental health in that moment is very important because you need to be calm, you need to think straight, you need to be able to adhere to treatment that you're receiving as well. Very, very important. You cannot separate mental health with a lot of things. You cannot separate mental health with faith and God. Same way with other, we're trying to make sure people understand mental health. It's not always a Chinama case when you think, when you say, no, my mental health is not okay. Don't think when you go to see a psychiatrist or a profession that it's a Chinama case. No. Talking to someone, these things I've talked about, you will find that these are things that we just do when you're stressed. We will not even give you tablets because that's the last thing we want to do. Unless when you become a danger to yourself or other people, then that's when we talk about drugs. Okay? For family members and the community, if you are one of the family members that have someone who's struggling, listen more than you speak. Do not admit to this person. Be strong. Don't cry. No, it happens. Okay? This does not help. What they need in that moment is just your presence. I like how women offer their support, especially when someone is grieving. So that support is very, very important in that moment. Offer the presence, not solution, in that moment. When someone just feels the party, do not tell them, okay, do this. You might find that maybe that's not what someone wanted to do. You end up being hated by this person because you force them to make a decision in a rush. So if you're the one who is the support system, avoid giving ideas. Allow this person to rest. Allow this person to think through their problems. If they will need questions, they will ask you. You can give suggestions, but do not be the last one to make the suggestion. Okay? Encourage professional help when they need it. Your support can reduce suffering greatly in this situation. So, as I conclude, mental health support in Zambia, I'm an advocate for mental health. I always talk about these things. We have government hospitals in all the districts, of course. We only think about Ndola and Chanama's big hospitals. Now, government has tried its best to train people, capacity build people on basic psychosocial support system. Everything I've talked about, if you open a clinic, you will find at least one person who has been educated in psychological first aid. They will give you psychological first aid, like the same first aid that you see when someone is in an accident. It's not always that you have to go to China, no. In the district, each district, like here in North Province, we have a district mental health officer who is assigned to that. If you have a problem, you're in Myanmar, you're in Lunga, you can just let us know. We'll tell you this is the person I can see there, and you'll be helped. We have faith and community-based counseling services. We have CBVs, those who volunteer to work in facilities. We have trained them through Ministry of Health as well. And they are working with us. They can offer this things you are saying. They know their level where they can fail, but at least in that moment, support system would have been given to you and you'll be okay. Where there's an emergency, please visit the hospital because some people go into panic state. Other people they think of the worst solution that is ending their life. Please visit the clinic. Where you go, do not expect to find a psychiatrist. We know what to do in that moment. Every clinician has undergone, every nurse has undergone a mental training. You'll be held appropriately. If you have to refer you, they will refer you. Asking for help is a sign of strength and not a sign of weakness. Remember that very, very well. The key message is to remember that bad news is not the end of your life story. You are allowed to ask for help. Strength includes vulnerability as well. Don't think when you're just vulnerable, you have no strength. Healing is possible despite the brain continue keeping these memories. It's possible to heal from that. So you can still have a problem and stay positive, live positively. Okay? And I complete this sentence privately in your own. After today's discussion, one thing I will do differently when facing bad news is, so you can now think about that. One thing you will do differently when facing bad news. Maybe you have been doing things in a bad way, but what is important is the small steps matter. Do not always rush in the big steps. End my presentation from here. Thank you so much. You are not alone. Let's continue the conversations. I now ask questions as I hand over back to Dr. Mutola. Thank you very much.
Thank you very much, Mr. Chipulu. It's quite an insightful presentation. And whenever you touch on mental health, it's something that is so big, and it requires time for people to understand. I'm sure even your consultations take quite long. Allow me to just go to the chat box, because there are a few people that have reached out. Some we've gotten their numbers, and just like I mentioned, when it comes to mental health and the journey that you're at, you are not alone. Please feel free to reach out to us. You can inbox your number. If you want to be part of our womb care clinic webinars, where we just directly send you these messages to say this is what's happening, including the recorded versions. If you can't go through our YouTube channels, please inbox your numbers, and we'll add you to our diary and to our sort of directory in terms of what we have. In terms of some of the responses, how people deal with the bad news, there is somebody who said they become sad. Others start denying things. There was also another response on denial. There was a comment from people, Boniface Msova, which said, when I receive true bad news, not news that just inconveniences and frustrates me, I usually go numb. Maybe I go into denial, but I don't process it there and then. I let it fester first, then react later. So that's one way in which somebody gets to process. Namonja says they become devastated, denying, and sad, depending on the bad news they've received. Somebody says they develop anger and depression, which kicks in, and they feel it never really goes away. There are other comments from Matami. It says, I feel blankness, lost, couldn't get my mind to think. And when we went to the coping mechanism, I hope you are taking note, Mr. Chipulu, and maybe as you throw in your comments later on. When it comes to the coping mechanism, people cope with alcohol and sex. Alcohol again came up. Kudza says they pray. Alcohol, and some, they become very spiritual. There's the issue of substance abuse. Others deal with work, saying, I fixed everything that was not working. So that's what they start doing, where they just start fixing things. And then in communities, some people go into depression and focus on prayers. In terms of support and who they reach out to. So there is family and friends, there is family, There is family and my friend. We were talking, there was a comment about mental health. I think a conversation that was going on with the Konenji was saying some people don't want to reach out to mental health personnel because they don't want to be diagnosed with a mental health problem. There was an outreach in the chat. I think we've gotten the person's contact, which says, "Hello, I've joined late, but I need help. May you summarize some of the points that you mentioned earlier? I'm a medical doctor. I lost my young sister 2 years ago in a road traffic accident. Another young sister a week ago to a maternal death. I am depressed. Both left 11 children in total. I need help. I need to be able, I need help to be able to help others. Who can I talk to? We're very sorry and we will reach out to you so that we can just see what type of help can be offered. Mr. Chipulu will share the contact of the person so that we can just see how best we can help them. And you're right to say you need help. You need help for you to be able to help others. Bibo Boniface Musoba says, I like that Mr. Chipulu has said that most of the times the spiritual leaders speak positively in our lives because some don't. I don't mean speaking bad, but misleading somebody. That their problems are caused by their grandparents who buried things to cause them not to prosper. When it's emotional and psychological blockages that keep someone stagnant. Because imagine in 40 years, I'll be the old grandparent, what I have buried for my children's children. Sometimes these spiritual leaders don't make us face our problems, but are merely projecting them on others. Sheko had commented that she has developed a meditation lifestyle, which has really helped her to regulate on how she reacts to challenges and how she copes to bad news. And she said this lifestyle was triggered by personal reasons. So for people in the chat, you can reach out to Shekwa. She's opened herself to say she can teach individuals on how to meditate and how to develop meditation as part of the coping mechanism. Tiko Zenji has mentioned that yes, people are ashamed of seeing medical personnel, mental health specialists in particular. Why? Because of the stigma that is related to this. And it is this stigma that is also there in society. So these are some of the comments that have been there in the chats. I don't know whether you can address some of them. For the people that have shared their numbers, you will be added to a broadcast group where we'll be sharing some of our webinars, including recordings, and just to see how we can build a community that is being helped in all aspects that are health related.
Thank you, Dr. Musawa, for that. So let me start with the response that came from coping mechanisms within the community. I've seen that there are positive coping mechanisms and negative coping mechanisms, like we talked about. I can point at alcohol and sex as not very positive coping mechanisms. Okay, sex with who? If you end up having a sex, there are people who are single and they undergo stress. You understand? And I was having a chat with someone. These people call themselves sex workers. They end up, sex is addictive. It's a behavior just like alcohol. So because you're stressed, we have seen people going to clubs. They will indulge into alcohol. Eventually, they start having sex and they end up being prostitutes. Okay. If you have a partner, if that's the best way you can cope, that's okay because you know you have a partner. Because you can't talk about sex if there's no partner. So it's something that this response is very subjective. It has positives and negatives at the same time. If you have no partner, you end up having infections, which is going to add more to your problem. Or it will bring something different that is going to have to add more to your problem. So the responses are two on this aspect. For alcohol, alcohol, like I mentioned, it's always people always rush to use alcohol to treat their own problems. But now there's science that your brain cells, there's a learning aspect in your brain. The area in the brain that also, has things of addiction as well. Like the same thing you're talking about sex or gambling, all those things. So again, when you become addicted, it will be another problem for you to come out of addiction. And this is what we are seeing most of the people around. In Zambia, we are struggling. We don't even have a public rehab center. People are paying 10,000, 15,000 a month for someone to be sober again. So really, alcohol is not a good thing. The old science will tell you to say no, there will be these units for a woman to use and these units for man to use, but there's no better way of coping. Let's say you've been told you have cancer or you have liver cancer, then you go to drink alcohol. What are you trying to do? It's like now it's suicide. So bad news here that you receive will be different. Again, these responses will be very subjective. But let's interrogate these responses very carefully and see that alcohol and agree that alcohol will not help you when you wake up in the morning. After you go back to the same problem that you had. Prayers are very important. Of course, I acknowledge the response that came from I've gotten the name again. I didn't write his name down. The name down about pastors who tell you negative things. We know there are people who are scamming others because most of the time they want to tell you things that you want to listen, things that have not been moving very well because of your grandfather and what. You can literally tell to say someone, and most of the time they will ask you for something because they want you to like sacrifice something for you to get better. And in Zambia, this is where we have a problem. There are churches that are very genuine where you can go to, okay? It's not always that you have to be Catholic every time or you have to be Pentecost every time. God is just one God that we pray. It has to be just different in doctrine. When you see that this pastor is saying these things with your good conscience, you can make judgment. I think this is very wrong. I'm not going to buy this. So it's the way people advise us. Like I said, who is advising you? What advice are they giving you? So you should trust your judgment first before you trust this pastor as well. All right. Yeah. Again, if there are churches, you can go and confirm what this person is saying. You go and confirm with other people as well. It's very, very important. Okay? It can be true. We cannot always like to say that when they tell you to say this, what this and this, it's not true. But can you confirm with other churches as well? If it's not making sense, then you can quickly note there, this is a problem because it will just lead into problems. Some churches they're asking for too much because they have to pray, and most of the time they're demanding for miracles to happen for us to come. And we feel sometimes we don't just take responsibility of the things that we did in the past. We feel someone is always responsible of our suffering. It's important to also introspect about our past life. Some decisions we have taken and some conditions that we are suffering right now is because of the things that we did in the past. So we need to look back where we're coming from and be responsible and accept that we did something wrong, and then we can positively cope and be positive in that moment. Yes. So the other aspect of fear of being diagnosed, this we used to see this the time HIV was just coming. You see now how people now accept HIV. People will just walk freely in the HIV space, take their ARVs. The same with mental health. Okay. The way we are discussing right now, we have a lot of people who are listening. Are we diagnosing someone here? It's just talking to someone and guiding you how to move through. Let's say you're coping badly. You're guided on how you can cope positively. If you're not sleeping, you can find something better. There are some things that you can guide you to improve your sleep hygiene. Because most of the time people want to drink alcohol because they're not sleeping. And they will resort to alcohol for them to sleep. We have ways of dealing with sleep problems when you're stressing. We have ways of dealing with painful, chest and other things when you're in that state. So the whole idea is for us to understand and to explain to you that this is happening because of the psychology that is happening around you. and your physical well-being is responding to the psychology that is happening, and you need ABC, and you see that the physical pain you'll be suffering will disappear. Of course, we'll need to contact that our colleague, our friend who mentioned about the loss. Yeah, yeah, he suffered. I think we need a lot of support system. Wherever he is, also we need to get a location. We can connect with people who are near him so that he can be helped as well. Dr. So I think this is what I can respond to for now. I think according to what you said. I don't know if there are questions again in the chat box.
Hello. Oh, sorry about that. I think I was muted and I kept on speaking.
Okay.
Yeah. I think I'm getting older
I
now.
thought it was me. I thought it was me.
No, when I saw you take off your AirPods, that's when I realized I wasn't being audible. So I'm
Okay.
saying, I think in the interest of time, there's a question that has been asked though, which seems to be quite pertinent in the way that most people get to react when they receive sad news. And the question is that how do I avoid panic attacks whenever I receive sad news? So somebody's asking, how do they avoid, having these panic attacks whenever they receive this heavy sad news?
Okay. So I shared the one intervention that is diaphragmatic breathing. It really helps when you're in a panic state because in that moment, what happens is that you fail to breathe. You're not breathing in that moment. Your body is having. There's no oxygen that is being supplied to your all vital organs in that moment when you're in a panic attack. So the best way you do is to sit down, calm down, and practice the diaphragmatic breathing that we talked about if you are following. If you need more help with that, we can still contact you and give you that technique. I hope we talked about it. That was the first one. I don't know if I need to share again the slide so that maybe we can look at it. If the person is just joining in, I don't know.
I think what we'll do is that we will share sort of the recorded version so that people can just go back and watch it. And just like I've
Yeah.
mentioned, if you want us to reach out to you, please inbox your number. I've seen somebody has reached out in the chat saying, please, I need help. I can't recognize myself since I gave birth to my baby 5 months ago. Please reach out to us. What you're feeling is it might feel like you're the only one that's going through this moment, but there are other people that have gone through this moment. And these are some of the things that even Mr. Chipulu and his clinic and the team gets to deal with. So reach out. Please share your number. I've sent a message, so if you want, you can just share it directly into the inbox so that we can reach out to you. Maybe just one last question. It's a two-pronged question that is there, Mr. Chipulu. I know we've gone a little bit overboard, but every time you touch on mental health, the people realize you're not alone. And I think that's the most important thing. I think you're not alone in this. We have a Scars of Womanhood webinar that is scheduled for in the next 2 weeks on the 24th, where we'll bring a woman who has been battling mental health her whole life, and she's willing to tell her story. She's been diagnosed with bipolar, and it's something that she's lived with. And she just wants to talk about psychiatric help and mental health. And that's something that will be very important for people to listen to. So there's a question which says, how can someone deal with fear of unknown? From nowhere, you just develop fear and anxiety. That's question number one. Question number two, is it normal to be completely numb when you receive bad news, where you feel completely nothing? You wait that maybe sadness will kick in, but nothing. So those are the two questions. How to deal with fear of the unknown. Suddenly you just develop anxiety, and fear. And then also when you just feel numb. I think this is the second person that has posted this. Somebody mentioned as well, they just feel numb when they don't feel anything. So please, if you can answer that message.
Okay. Thank you very much, Dr. Msoa. So the fear of unknown, commonly known as generalized anxiety, because you can't point at the one thing that you are scared of. So it's difficult to deal with it on your own. We might need to chat further on this one, because there are some triggers that you cannot really say you don't know. Sometimes it has triggers. We have triggers that brings up this condition. But again, that fear comes with physiological responses, where your heart starts pounding, like you're going into panic again. Some people, they even faint, especially when you are facing that situation. So the same thing, the breathing technique works in case you are alone. But we need to explore further, kind of reach out to us what you can ask, because sometimes there's some things that happened to us in the past that we've kept in our subconscious. There's an aspect of the new science that talks about epigenesis. These are the things that happen in your life that you have passed through bad things and you've never dealt with them. So you have still hidden them in your brain, but they are not disturbing. You're able to function. But we just come up with some things. You come up across some situation. You go into that state. So we need to explore quite a lot of things here. Yeah. And the issue of numbness, we talked about this feeling. It's a common feeling when someone faces bad news, just going numb. You don't know how to react. Very common in men because of the nature and the culture we've been given. All right. But what is important is when you feel like this, it's difficult because it becomes a problem. You don't know what to do. And these people are at risk of, extreme decisions because you don't know how to feel in that moment. And sometimes this person could be in the presence of a person who understands emotional intelligence. They know that if these things happen, someone is supposed to cry, or you're supposed to to do ABCD, and they are perceived like they're not normal. So this again is important that maybe you see, especially so they take you through on an aspect of the emotional intelligence. Very, very important. But the feeling is very, very normal. You can, but again, this is very, does not go for a long time. Eventually, you respond. You just start seeing your behavior changing. Maybe you start drinking. Okay, you acted like you didn't feel anything. You just start coping in a negative way. So it's something that we need to sit down and explore further. So you kindly reach out to us so that you can discuss these feelings. Thank you, Doc.
All right. No, thank you very much, Mr. Chipulu. One last question from the chat before we close. This may not be related to the presentation, but I'm compelled to ask, how does one deal with grief 7 years after the death of a loved one? Especially when no single day goes by without thinking of them, and it's still painful as the day they passed. So I have asked the person to reach out to us, but I think this is part of what you are presenting in terms of the bad news itself. Somebody receives bad news, and then this is bad news in the form of loss, and then this loss continues in the way that the person experiences it. So maybe just a quick sort of umbrella answer, one that is targeted towards this. Like, how does one get to deal with this particular grief? And this is a person that's saying 7 years has passed. They're still at the same pain and at the same loss each and every day.
Thank you for that, for sharing, for being vulnerable and sharing that situation. No, grief has stages on its own. In the last presentation, I mentioned that sometimes you don't go through all the stages. You just remain in some kind of denial. in this situation, 7 years is too long to stay in that situation. We need to explore further. Have you been depressed, or are you now having some kind of PTSD? Because this that you cried, you have not still accepted. It could have complicated into another major mental condition that might need to be sorted out. Because now we need to understand, if every day you're thinking about this person, are you functioning? Are you sleeping? Are you working? Are you eating? So that we see how severe this condition is. Okay, these bad news that we receive, they always complicate into major ones. No wonder we are talking about them right now, so that we can work with the psychosocial intervention that we have talked about, so that we prevent such kind of presentation that our friend have shared in here. So maybe we also need to get the contact from this person. We understand and we explore further and just understand how they feel in other aspects of their mental well-being. Thank you.
Thank you very much for your presentation, Mr. Chipulu. I think it just shows you that we need to be having these conversations more often. We need to be having these sessions even much more often, where we talk about these things, because there are a lot of people that are in need of help. There are a lot of people that don't know who they can speak to. Like you mentioned, there are so many support systems that are out there, but sometimes you find that where you're supposed to receive the support from is the source of your trauma. And I think it becomes very, very difficult in those moments. But we appreciate people like you. We appreciate you, Mr. Chipulu, for all the services that you offer to even us as medical personnel, because we do receive bad news and we do need to find ways of having healthy ways of dealing with this. So thank you very much for coming to this platform. Thank you very much for your presentation, which has been insightful and has opened up so many conversations. And for people that will still need help, please reach out to us, Womb Care Clinic. We've posted our line. And for those that we've gotten the numbers, we'll add you to our broadcast list. We'll share this presentation. For the people that need help, we will reach out to you to see how best we can link you up with Mr. Chipulu, how best you can receive that help. And I think the message is that you're not alone. Mr. Chipulu, as our speaker, as our presenter, please, I'll give you now the platform for you to give us your closing words and your closing remarks, and then we'll close the meeting immediately after you have spoken.
Thank you so much. It's always difficult to deal with bad news. The emotions that you feel, please accept them, but validate the ideas on how to deal with the problems. Do not be in a hurry to make some decisions. You need to take time to make some decisions. If you don't have good support system, ask for professional help. Like we said, it's not weakness to be vulnerable. Okay? You need just to share to someone. It really helps. Sharing your problem will be solved. You will know how to solve it. Sometimes we fail to solve our problems because we cannot really have a discussion around our problems. But when we have a discussion around the problems, you will see that things will be okay. So let's continue discussing. Thank you so much for everyone who was on call, and continue being mentally healthy for the rest of the week. Thank you so much.
Thank you.